But on the other hand, we have a solution for you. You can go to our social media handle, especially our Twitter handle, Traffic Radio 961, and you can watch all the back episodes of Save Blood Arena to play catch up. All right, so today on the program, we haven't had this guest, I'll call her a guest, in the studio for a while. We've been trying to have her back in the studio, and today, thankfully, she's back in the studio. I'm talking about the Executive Secretary, Lagos State Blood Transfusion Services, Dr. Bodunrin Oshikomaya. Good evening, welcome again.
Yes, I was going to say welcome to this. Actually, it's so nice to be back here. I've been enjoying listening to the show. It's been very educative. Despite the fact that I work with the blood transfusion service, it has always been nice. And I really, really wish many people will join in to listen and learn from everything that entails blood safety.
Yes. And of course, I have Taiwo Oloko. Good evening, welcome.
Good evening, thank you.
All right, Taiwo has been wonderful. He's really been wonderful. He's been holding forth for you, credibly. All right,
yes, yeah, I do agree. Thank you very much. And I know that many people living in Lagos and listening to you all around the world, I do really appreciate all the information and the education you've been giving out to them.
Thank you.
All right. So today on the program, we're discussing the importance of availability of blood during trauma care and other emergencies. So let's start by reminding our listener, those who are probably listening for the very first time, the vision and mission of the LSBTS before we move into the importance.
Okay, thank you very much once again. So the vision of the Lagos Blood Transfusion Service is to ensure that safe blood is transfused in all appropriate healthcare facilities. So when we mean safe blood, we mean blood that is free of all transfusion transmissible infectious agents. I'm already going through to the mission statement, actually.
Yes.
And so for us to be able to meet up with that vision of having safe blood transfused for all that require it, it must be done through the recruitment of voluntary blood donors, because voluntary blood donors are deemed to be the safest types of blood donors. It means that the blood must be well processed, and in processing the blood, we are talking about having the grouping and cross-matching done, ensuring that phenotypes are done, ensuring that the appropriate blood group systems are checked for, then checking for transfusion transmissible infectious agents. And in Lagos State, this is done using a fully automated system now, so that there is minimal possibility of having a false result in the blood. And finally, to ensure that there is appropriate clinical use of blood. So those are the things that entails blood safety, and those are the things that it entails in our mission statements.
Okay, so then since you already delved a bit into that, the next question, let's look at how availability of blood affects patient outcomes during trauma and emergencies.
Well, that is quite simple and easy to just reason out. Once there is an emergency, we know what happens during emergencies. Everybody's running helter-skelter. The life of the patient or the person is usually on the line, especially when the person is bleeding excessively. So once there is availability of blood, timely availability of blood, because there's a difference between blood being just available. It might be available 2 or 3 hours after. It might be available an hour after. There's something called timely availability of blood. So once there is timely availability of blood, it ensures that there is increased survival. So the person will survive. But much more than just the person surviving, there will be reduced incidence of having damaged parts of their body, like end organ damages. Sometimes when you lose blood excessively and you don't quickly replace the blood, it could affect the kidneys, it could affect the brain, it could affect vital organs in the body. So when blood is available at the right time, all those things will not happen. And finally, some people's life, it might just take seconds of bleeding before we lose them. So it also ensures that there is reduced incidence of losses, as the lives are not lost when there is timely availability of blood. So all in a nutshell, there is overall survival of those that need blood during trauma and emergencies.
Okay. All right. Quickly, let's see. We have an incident report. A 20-foot container laden truck, according to the driver, has a steering problem while on motion and ran into the drainage at Capital Inward Trinity Police Station. That's around Coconut. The tow truck has been contacted for evacuation. And to also inform you that from the 3rd Mainland Bridge, Inward Ifako, Ogudu, we have a good movement, but as you approach Alapmare, it gets you experience a moving traffic. All right, from the live camera here in the studio, I can see that it's a moving traffic. It's before you get to Alapmare bus stop. Actually, it gets heavier, but we keep updating you as soon as we get additional information concerning what's going on there. Just could be bus stop activities and fuel station activities. And at Ojota, Ketu Inward Ojota will have a good movement. However, the return journey, that's Ojota Inward Ketu, on the main carriageway and on the service lane is getting slower as you approach Ketu. Now, talking about availability of blood affecting patients and patient outcomes during trauma, how does the LSBTS handle blood supply during trauma and other emergencies?
And before I answer the question, I think it would be nice for me to acknowledge the events that happened in the past 1 month. Mr. Governor inaugurated the first trauma conference organized by the Lagos State Ministry of Health, where every stakeholder with respect to trauma was involved. So we had the blood transfusion service, we had the Lagos accident and emergency centers coming in, we had private and public advanced services, we had nursing, the last Lagos State ambulance services coming in. We had Lassen bus. We had the trauma nurses generally in different sectors. They all were there, and then we had people that provide equipments, vendors that provide equipment that are related to management of trauma, like defibrillators, like suctioning machines, people that procure and also provide oxygen were there. So trauma generally, a lot of things happen during trauma to ensure that the lives of that person is saved and we do not lose anybody generally. So during this conference, we really did talk about some of the things that each stakeholder should do, and some of the things I'll tell you are things that came up from that trauma conference. And preceding that trauma conference, we had workshops by stakeholders where we deliberated on the best thing. What are the low-hanging fruits? What are the things that we can achieve based on our existing KPIs, existing key performance indicators, and as well as the mandates of the people involved. So the first thing is once there is an emergency or a trauma or a disaster that needs a lot of blood and needs availability of blood, the first thing is to begin to implement what you call the disaster protocol. So there's a Lagos State Blood Transfusion Service disaster protocol. This is a protocol that we just bring into action immediately there is a need for blood. And when we call something a blood disaster, it means that there is a need for blood, much more that is available at that time. Wherever. So if a disaster, if there's an accident happening, for example, remember that accident that happened at Berger area? There was a time that a truck crushed some kids at that time. Once, when they were bringing the kids, the first point of call was the Lagos Accident and Emergencies. At that time, because a lot of people were coming into that facility at that time, there was a higher need for blood than they had at that time. So in that place, there would be they would bring up the use of the disaster protocol. That doesn't mean there is no blood in the next available place, maybe at Lasut, or there is no blood at Bagada. There might be blood in those areas, but for that particular environment, we must look at the availability of blood compared to the need at that time. So the first thing there is to implement that protocol and put it into place. And the next thing there is to communicate. We want to communicate. Oh, how many people are coming in? We have had 10 people. So there must be a lot of communication so that we know the estimated need. Because without knowing the estimated need, we really do not know what to do.
True.
The estimated needs, and how do we get the estimated need? We depend on people at the site of the accident. We have usually we have other agencies like Lassenbos, for example, who call to us. Lagos Blood Transfusion Service. We have 5 people that need blood. Please ensure that there is blood for them. Some of them are bleeding excessively. So there is an estimated need, and that communication is very key because it helps us to plan. Immediately the estimated need comes in, we begin to plan. The first thing in emergency that we do is to implement the emergency release thereafter. So what is the first unit of blood that we release? There's something called the blood group O negative blood. Blood group O negative blood could be transfused to anybody without cross-matching. So when people are coming in, so we must make available that blood group O negative blood at that time and all the time. So if there is an emergency, people are bleeding and we are running, the first thing that comes to our mind is to have an emergency blood release of that particular blood group. If it is not available, then we must now use units like what? The blood group O positive units. And while we are giving it in emergency, we must continue to do what? To cross-match the blood to ensure that there are no blood transfusion reactions. So those are very critical decisions that are made at that time. And if there is no available blood, then we'll collect the blood and do the normal routine testing. The normal routine testing will not be the 1 hour that will happen when the patient has probably needs to have a surgery in a week's time. It is done within a maximum of 15 minutes because time is of essence during emergencies. And finally, when this is being done, we begin to communicate with other centers to give us their stock. How much units of blood do you have at center A, at center B, whatever blood you have, it is brought into the center. So the blood logistic companies are also brought into play, whereby they collect blood from different centers. Sometimes it's not the availability. It's not like there is no blood in the state. Sometimes the blood is not where the blood is needed. And the best way to get it is to use these blood logistic bodies, which are usually on bikes. That's on, and they will bring it from wherever they are. Those bikes, but motorcycles really do not get affected by the traffic, and they are usually faster. So they'll get the blood in. And so the coordination of all those events are what the Lagos State Blood Transfusion Service entails. So the blood is here, let us use it. Do we need to cross-match the blood at this time? Should we wait and not cross-match? So a lot of decisions are made during that period. And that is why for every blood bank, especially in the public hospitals, there is always a scientist there that is working with the Hospital Blood Transfusion Committee to help to make such critical decisions. So generally, the Blood Transfusion Service coordinates all those things. So we have the emergency officer who also coordinates the activities in all other blood banks to ensure that if there is blood in a center that is not close to that place, we can call the logistic bodies and ensure that the blood is used as at when due. Overall, blood is never enough. So let's look at what happened, because I'm going to use a lot of examples to educate Lagosians. Let's look at what happened at the Ikeja bus train collision. So this first stage was done, and the next thing we did was to encourage emergency blood donation services. So we opened up centers because it's never enough. We need more blood to come in. We've used all the blood at other centers, and no blood needs to be used. So we had those emergency blood donation centers where people came to donate, and then the screening centers were open for 24 hours until we passed that phase. So the screening centers, that's the blood screening centers, to ensure that there is no HIV in the blood, there is no hepatitis B, hepatitis C, or syphilis. They were open for 24 hours, and they were working back to back. So as people were donating this blood, the blood was being screened to ensure that they were safe. Also, all all the blood component centers that make things like that produce things like platelet concentrates, as well as the fresh frozen plasma, we're also working 24/7 until the crisis period was over to ensure that the available blood products are also in use. So it's usually a barrage of a lot of events happening everywhere. And as I said, the blood transfusion service coordinates all these activities so that there is no gap, and so that we will not say that at the time blood is needed, this blood is not available. Thank you very much.
Thank you so much. There's really so much. I'm listening to everything you're saying, and everything that goes into making blood available for transfusion during trauma or during emergency. And I'm thinking about, the fact that a lot of people, or a lot of the healthcare workers, have to think on their feet. They have to do everything, not mechanically, but they have to, because they have to concentrate on everything they're doing, so there's no error in any way or form. Now, I want to ask a question quickly before I move on to Taiwo. Is there, can you tell us off the cuff if you have a higher percentage of the O negative, which they call the universal donor, O negative as compared to other donors? Do you have a higher percentage or a lower percentage of people, maybe a certain catchment area? Do you have a higher percentage of people with that blood group who are readily available to donate?
Yeah. So generally, Africans have a lesser percentage of O blood group O negative donors, and so everybody that has a resource negative is included in our rare blood donation register. So resource negatives generally are really scarce. The percentage is about 10 to 15% in Lagos State from our own data, and 10 to 15% does not mean all of them can donate at each time. So there are times when we just look at those that can donate, and we barely have 5 people that are eligible to donate at that time. So at the blood transfusion service, our rare blood donor register consists of every individual that is resource negative. So that when there are emergencies like this, you don't even wait, you just call them. Please, O negative people, can you please come? We need your help. O negative people, please come. And usually, because they are, as I said, not all of them are eligible to donate at that time. You know, the protocol says that if at the time we need the O negative is not available, then you use other blood groups. That is where we have the blood group O positive. And then we might need to take blood samples and begin to test, which will make sure, which will mean that it will take a longer time for the person that needs the blood to have it. But the truth is that overall, even though we want to save lives, we must ensure that we do not add much more damage to the person's life. So we must do that testing when it's not available.
Thank you very much. Taiwo, quickly tell us in a few minutes, what role can Lagosians play to ensure there's availability of blood during trauma and emergencies?
Thank you so much. The first thing that we usually encourage is people should become voluntary blood donors, regular voluntary blood donors. Like my ES said, when there's a trauma or a major emergency, the units of blood in the particular center where the emergency, that is only the emergency, that's what they use. And when they need more, they get from other sources, from the other general hospitals and other, and the BTS, of course. But the first thing is, as much as possible, yes, blood is never enough. That's why we need more people. So the first thing Lagosians can do is become regular voluntary blood donors in the first place. That's the first thing, because the best thing is for the blood to be available before it is needed. Then secondly, they should encourage other people. So if you're a Lagosian and a regular blood donor, encourage your friends and family to also become regular blood donors. Because this thing, the volume, the quantity of blood available at a particular time affects our ability to respond to a major trauma or major emergencies. So if it's low at a particular time and there's a major emergency, it's going to affect our ability to respond to it. So as much as possible, yes, is an ebb and flow kind of thing. It's a never-ending cycle. But as much as possible, Lagosians should encourage others. They should become voluntary blood donors, and they should encourage others to become voluntary donors. And then when there's a major emergency and there's a call for people to donate, then they should, respond to the call positively.
Okay.
Go to the nearest general hospital and donate blood. Even if you're far away, that blood may still get to the trauma site.
Exactly.
Because if you're living in Ekpe, for example, you don't have to come to Ikeja to donate. Go to the Ekpe and donate, and then one way or the other, if it's needed, it will be retrieved from there. It would still help the collective pool of blood available to treat and to manage the trauma and the emergency situation.
Awesome. All right, so if you've just tuned in, you're listening to Safe Blood Arena on Lagos Traffic Radio 96.1 FM, and we have been speaking with the Executive Secretary, Dr. Bodunrin Oshikomaya of the Lagos State Blood Transfusion Services, and also the Quality Assurance Officer, Taiwo Oloko. And we've been discussing the importance of availability of blood during trauma care and other emergencies. Quickly, I think I have an update here. All right, so let's see. Okay, so all right, the earlier reported incident at K2 where you had a Benz truck with a mechanical fault at Demori on the main carriageway inward Yano School, Kushofe, is now off the road. So you should be experiencing better movement there any moment from now. But we have an incident report from Apapa, a 20-feet container-laden truck with steering problem. What happened while on motion and ran into a drainage at Capital opposite Trinity Police Station, Inward Coconut. So we'll keep you updated concerning that in a few minutes. Well, the roads are still looking good, and the earlier report, we had a report earlier from the, let's see, all right, let's quickly take this. It's consistent. Hello.
Hello, good evening.
Good evening.
It's Stephen.
Yes, Stephen, how are you doing?
Fine, good evening.
Good evening.
Thank you. Yeah, I quickly want to give this update.
Okay.
Temelan Bridge.
All right.
Sonikodu Road, very briefly.
Mm-hmm.
Yeah, our movement coming all the way from Ombalende inward Ilubiri. Likewise, movement from Osborne end to connect Ilubiri Adeniji.
Mm-hmm.
We still have it good at this time.
Okay.
The entire Temelan Bridge, nothing to worry about, except at Oworo, where we have it busy a little at the bus stop as a result of commercial buses picking up passengers.
Okay.
But beyond that point, coming from Bagada inward car wash and Oworo inward car wash is good all the way until you get to Ogudu.
Okay.
A little after Ogudu, all inward
Alapere, yes.
we have it slow at this time, up to NNPC. Now, immediately after, it's good to go all through until you get to Secretariat bus stop, where we have it busy at the bus stop.
Okay.
But it's good to get all through to
Okay. Okay.
Then, on the Co Bridge, are you waiting to take that?
Yes. Quickly.
Okay. Yeah, on the Co Bridge, that's beginning from Broad Street. That is from Tinubu Square through to Martins Junction, connecting Akpogbombana the bridge. We have it busy this time.
Okay.
Then from that point is busy towards Oloko connecting Butero.
Yeah.
We also have it busy.
Okay.
But on the Co Bridge, all through, it's a very good one. Then beyond that point, good to go until you get to Stadium bus stop, where you have it busy a little by the bus stop. Beyond that, it's good movement all through to by connecting Domalon Bridge.
All right.
Nothing to worry about as such until again you get to Ikeja Electric by Shimbolu.
Okay.
But that you have it busy on the service lane. But immediately after that, it's good to go until you get to Antoine Baudane the bridge, where you have it slow.
Okay.
After that, a good movement towards Maryland. It is when you get to Maryland, you have it busy intermittently as a result of alternation. Then the rest of the movement through the independent tunnel to connect Odoyalaro New Garage to Ojota is very good. But from Ojota to Interchange is slow. Then Interchange moving to West Tipa to Demurin, we also have it slow at this time.
All right, Stephen.
That is?
Yes, I have to, because I need to round off now. I have just 2 minutes to round off. So,
right, okay.
But we'll take the rest after 5 o'clock. Exactly. Thank you so much.
All right.
All right. All right, then that was Stephen from the control room giving us an update. All right, then quickly in rounding off, what is that one thing that we want Lagosians to know about about voluntarily donating blood?
So, voluntary donating blood for emergencies. I think there's so many things you can know. So, once you continue to voluntarily donate blood regularly, you are sure that during emergencies the blood is available.
Okay.
And I also want to know, Lagosians, know that once there's an emergency, there is a disaster, the Lagos State government pays for all the blood used.
Okay.
Even there's an accident, and the blood and the patient or the person involved in that accident is taken to the Lagos State Accident and Emergency Center. They should be rest assured that the voluntarily donated blood there is given to them without need for payment for screening.
Okay.
Those are things that Mr. Governor has been doing for a while, and he has strengthened it to ensure that nobody during emergency needs blood.
Okay.
Yes. So all those emergencies we talked about, none of them paid for screening of blood.
Okay. All right. Thank you so much for being in the studio. The Executive Secretary, Dr. Bodunrin Oshikomaya, thank you so much. And also, Taiwo, thank you very much for being on the program as well.
Thank you.
All right. So you can, if you need more information, you could follow the social media handles of the LSBTS. On Facebook, it's Lagos Blood Transfusion. On Instagram is Lagos State Blood Transfusion, and on X is Lagos BTS. And the telephone number is 0806 920 7914. Again, 0806 920 7914. My name is Dele Agadumo. Big thanks goes to Victor Terry and executive producer Taiwo Akonle. Enjoy the rest of your day. God bless.